Hip replacement surgery is now one of the safest surgeries being done in the USA. Approximately 200,000 Americans have a hip replacement procedure annually. Of those, only about 2% have complications. Hip replacement surgery is no longer as big a deal, so to speak, as it used to be. Advances in recent years have resulted in smaller incisions, leading to less pain and faster recovery times. Here are some things you should expect if you're generally in good health and your doctor has recommended a hip replacement operation. You'll probably spend just 2 to 3 days in the hospital. Soon after your operation, a physical therapist will review precautions you should take getting around in the weeks that follow. Expect to be doing a lot of exercises starting right away. Your doctor may prescribe outpatient physical therapy for 6 to 8 weeks, 2 to 3 times a week. You'll probably need a crutch for 4 to 6 weeks. If you're still working, expect to be off the job 1 to 6 months, depending on the physical demands of your profession. You'll be advised not to bend your hip more than 90 degrees, so when you sit, your knee should be lower than your hip. You'll also be told not to cross your legs whenever you sit. You should not drive until your doctor tells you it's okay, usually several months. Driving, which is one of the worst hip positions, will prolong your recovery. You'll need to use a shower bench and raised toilet seat to make bodily functions easier and safer. Your therapist will also show you how to get in and out of bed, stand, and walk. You may need to sleep with a foam wedge or adduction pillow between your legs for about 3 months. This will keep your hip stabilized while you sleep. Approximately 6 weeks after your replacement, you'll probably get a series of x-rays to measure the progress of your healing. Typically, basic recovery takes about 3 months, but a full recovery generally takes about a year. How fast you recover and regain your strength also depends on your general health at the time the operation is done. Everyone wants to know, of course, how much the procedure and recovery will hurt. Doctors say this varies by patient. Minor pain to one individual can be major pain to another. Here are some general guidelines about pain management. Expect some surgical discomfort for 2 to 4 weeks. Some patients get by with nothing more than over-the-counter pain relievers. However, most people will need something stronger for about a month afterward. If you had osteoarthritis in your hip before your operation, it will be gone. You can start doing things that you haven't been able to do for years. Ask your doctor about your limitations. The purpose of this video has been to provide quick, basic answers regarding recovery from hip replacement surgery. For additional information, see links to related resources below the video screen.